My name is Carol Engelhardt, and I'm a retired nurse who works on the Minnesota Physicians for a National Health Program board. And I am joined with my colleague, Anna, who is currently still a working nurse. And we have asked her to come visit with us today about what it's like to be a frontline worker in today's time of COVID-19 in Minnesota. Anna, in your experience as a nurse in the past 2 months, what has your engagement with patients been like?
It's been tough. Everybody is really scared. I do work on a unit that has been designated strictly for COVID-19 patients. A lot of our interactions are via video monitors for our own safety as well as everybody else's safety. We don't spend a ton of time in those rooms.
Let's go into that a little bit more detail. Do you feel like you have enough protective equipment in your unit you're working with now, or how has that evolved?
Right now, we have been given surgical masks. We get 1 surgical mask per day. We have a face shield that is to last as long as we can wear it until it falls apart or doesn't do the job anymore. We are provided N95 masks for certain procedures and treatments, but we don't wear them on a routine basis. So yes and no. I feel like the CDC has kind of been a moving target. There have been lots of changes in the recommendations from the CDC, so it's kind of scary. It's hard to say. They keep changing whether this is an airborne precaution or a droplet precaution, and so it's kind of hard to say if we have the right equipment. I feel like nobody really knows for sure what the right equipment is at this point.
Do you have similar gowns to what I would wear when I took care of a MRSA patient? Do they give you an extra gown?
That's exactly. Boots? Yep. So no booties. Initially, the hospital did not provide us hospital-issued scrubs, but we were afforded that later on, maybe 2-3 weeks ago. So they allow us to wear hospital-issued scrubs that can go into their laundry there.
Oh, that's perfect. Because I know even years ago when I was a hospital step-down unit nurse like you are, I would immediately at 1 o'clock in the morning when I got home, just take everything off and put it in the laundry and shower, because I worked on a medical unit or a medical intensive care unit, and I didn't want my family being exposed. But in this situation, the risk is so much higher.
It's scary, yeah.
Okay, well, tell us your observations and experience as a nurse, how this has been and how it's affected you or the family members.
It's tough on everybody, I think. As a nurse, we innately want to go in rooms, we want to help, we want to do everything we can to help people who are struggling. Some of these people have the classic symptoms, the fever, the cough, the respiratory issues, and some of them have different symptoms where they maybe don't have appetite, they can't smell, they can't taste, they're nauseated. A lot of the respiratory patients, it's very hard because we're not doing treatments like nebulizers, we're doing inhalers instead to prevent that droplet spread of things. Patients, obviously when they can't breathe, they get anxious. We can't be in the rooms to comfort people. We can't be in the rooms to, help them stay calm or to do those things. We're kind of dissuaded to do that for our own protection. The other thing is families can't come and visit unless death is imminent. We do lots of kind of video conference calls with people or FaceTime, those kinds of things. It's hard. We've had a few deaths on my unit where family members have had to make the decision whether or not they can quarantine themselves for 14 days, or maybe they have children at home. They really have to think about what kinds of choices they're making. Can they come and see their loved one? Is it worth the risk? Could they possibly spread that to their families at home? It's hard to watch a patient decline from a monitor and not be able to do the things that we as nurses normally do. It's kind of heartbreaking. It's hard. It's hard. Yeah.
Thank you for sharing that. I mean, it is just, I guess words can't express what you've said. It's just really hard. As a nurse, we go into nursing to care for patients and hopefully see them get better. I think of people dying as extraordinary circumstances that happen to them, or, you know, they're older. They're older than 80, they've had life happen to them, and you get that full experience of the family being able to be there and going through that dying process with them. But this is just unheard of. I don't think any time in any of our nursing careers we've experienced anything like that. Have you had any wonderful stories where people did walk out, and did you have a way to celebrate that as a unit?
We did. We had a gentleman who had his 101st birthday on the day that he left. And
oh, wow.
So we were able to celebrate him and gave him a big exit. Lots of singing and cheering and smiles and laughs. I mean, there are good stories coming out of this, and we definitely see people go home. So yeah, I mean.
Thank you. But let's transfer to your home life. You have a husband, you're a mother of 2 children. How does it feel to go home to your family after working in a COVID-19 unit? And are you able to find meaningful support, or what are you doing for quarantine or not quarantine?
You know, obviously my single biggest fear would be that I would bring COVID-19 home, that my family would get sick. We're very, very careful. You know, my fiance and I, we speak a lot about what's going on, and I think that he's been very supportive in understanding that, you know, work is stressful, work is hard.
You're able to see your family and children at this time?
I am. I have chosen to be home with my family. I do have coworkers that have chosen to quarantine. In my home, we don't have the ability. We just don't have the space. But
okay. So this is the way it is. I mean, that way you can still be with your 18-month-old and 12-year-old and your fiance, and we really support you in that. What do you see as something that we can do better as a nation or as a state or just people in the community? What do you see?
I think that we really need to take the CDC's recommendations seriously. You know, you see people out and about that don't adhere to the mask in public or the social distancing. I understand people are anxious and they want to live their life, but I think that people really need to think about fellow man. I mean, it's not just about you. It's about your older generation, your immunocompromised people. It's not about us healthy people. It's, you know, it's about other people and caring for your community. And, you know, it takes the village. It really does.
Contact tracing and testing, social isolation, wearing masks, being aware of where you're going and what you're doing. Would you agree that those might be the best we have for right now?
I do. I know that at the hospital we've been trialing some things, you know, the antibody therapies. Nothing is for sure right now. I think that's the only thing that we can do. I don't think there's a good answer right now. I really don't.
Okay, well, thank you for sharing that. You know, we did have some conversations before we went on this recording about how I got in the fight for single payer healthcare coverage. Are you familiar with what single payer is?
Yes.
Okay. In a certain time, I don't know if you're aware of this, but there's actually a Healthcare Emergency Guarantee Act that is sponsored by Representative Jayapal and Bernie Sanders. And in this, everyone would get who has lost their job full coverage for health care, just as if it was Medicare for all with the prescription drug coverage. Are you aware of that bill?
I am not aware of that bill, but it sounds like a great idea.
Okay, well, we're going to put up information so that people can call, because one of the most important things people can do is spend 2 or 3 minutes just calling their senators, our representative's office to support this bill. And what I would like to say is single payer covers everyone from birth to death, even undocumented residents. And so many times there's just unfair access to healthcare with employer-driven healthcare. Would you share how you believe in this too, or what?
I think that healthcare is certainly it's a right. It's not a privilege. It's a right. I feel like everybody should be afforded healthcare. As a nurse, I think that just the preventative care that could be obtained using these measures is immeasurable. I work on a cardiac floor. I see people who are very sick, who much of the time can't afford to go to the doctor. They can't take their medications because they can't afford their medications. They come to us because they're so sick that they can't be at home anymore. If these people could get the health care that they need, they wouldn't be coming to see me. We could take care of them at home. In a time like this, when that's so key, when people need to stay away, that's so important. Not to mention the education that we could provide people and know that they could follow through with our recommendations because they have the ability to, with health insurance, to follow up or to call if they have problems or to get their medications. I mean, that's so important.
I agree totally. And just to clarify, single payer health insurance is one public insurance plan where everyone gets a card from birth to death, and it's a public revenue funded. But the clinics and hospitals, except for the VA and Indian Health Services, stay privately owned. And right now, with 38 million Americans unemployed, they're losing their employer-based insurance, either going on to COBRA or applying for Medicaid. So it is a real problem where we would not have this problem. We would not have employer-based barrier healthcare.
I agree 100%.
Well, thank you so much for sharing your story with us today. And I just know you're in it because you care so much. And I'm not going to specifically call you a hero because I don't know about you, but I was thinking, well, we just do this because we're nurses.
Exactly.
So thank you very much, Anna, for spending time with us today for Minnesota Physicians for a National Health Program Lunch and Learn sessions.